I still have messages coming from my WhatsApp. Can you see my screen, please? I have shared my screen. You can just signal with, there's an option for you to click the hand signal. It's an option. Okay. So like I posted in the group, we are going to be handling some critical areas in nursing, which are very important. We are not going to go like we are having detailed classes. We are doing question and answers. And the way I've tried to prepare the notes is that we have a briefing of the course, and then we answer questions. With that, you better understand what we're talking about. So we're going to be seeing, working on how to care for patients using tubes, patients who are on tubes, who are, maybe feeding tubes, or maybe respiratory system tubes, or chest tubes. So we're going to see that. But these are three important areas, but today we are going to handle two, okay? NG tube, PEG tube, endotracheal tube, and tracheostomy, okay? These two, GIT and respiratory. We're going to handle chest tubes in our next class because it's actually long. We will not be able to treat all of these three sessions in one class. You might want to have a pen and paper with you to take down some notes. Like I said before, I'm going to post this session on YouTube. You'll be able to have it on YouTube and watch it over and over. I hope that subsequently we're going to be having more classes to handle some questions of this nature, important topics that will help you for those who are preparing for their exams, and also those who are working, you help you at your job site, to also help you at your job site. So, like I said, let's get started. Now, I hope you should be able to see my screen. This is part 1 of 1 to 3 that we are going to treat. Like I said, we will treat part 1 and 2 today. We're going to treat part 3 in our subsequent class. So part 1 is gastrointestinal tube feeding. We're going to see how we have to feed the people. We are talking about nasogastric tube here. When we say nasogastric tube, we mean the tube is passing through the nose to the stomach. This is the one we are going to take care of. We're not going to treat nasojejunal tube, gastrostomy tube. We are not going to look at jejunostomy. We're not going to look at that. We're going to look only at nasogastric tube. So these are, for some of us who may be able to see, I think we have seen nasogastric tube. Some of us have not seen PEG tube. We are going to see PEG tube. But for NG tube, we have seen this is how they look like. And you have to pass it through the nose. You can see here, you're passing it through the nose to the esophagus and into the stomach. You can see it from there. So this picture is giving us some highlight. This is an NG tube inserted from the nose, esophagus, up to the stomach. This is it right here. A moment.
Which one is?
So, NG tube is also called raised tube. Okay, it's also called raised tube. NG tube also called raised tube. And what do we use it for? Indications: to decrease risk of aspiration, also to decompress the stomach by removing fluid or gas, It also allows the surgical anastomosis to heal. It's meant to use it to administer medication, especially for patients who cannot swallow. Maybe they have some upper GIT issues that they are unable to swallow, then we will have to pass NG tube for them. Patients who are just recovering from some surgical procedures and they have been hyper-anesthesia with over-anesthesia dose will cause for the system. Please mute your, can you mute yourself, please? Mute yourself. Yeah, also maybe there's some sort of poisoning which they have to irrigate the stomach. They will have to pass the NG tube, also called the raised tube, to use that. And we have basically, this area is not much important, like two types. We have the Levin tube, which is a single tube, and we have the Salem Sum tube. It's a double tube, you know, it's a double tube. These areas are not much more important. I want this class to be as short as possible. It shouldn't be more than 1 hour, and it is very long. I'll try to go as fast as possible. And let's look at the procedure on how to insert the NG tube. This is a very important area, how to insert the NG tube. So first of all, you need to follow your facility procedure. You have to know that what you read in the books are very important, but you must always follow your facility procedure. That is why when you read in your textbook, they will tell you how a procedure is done, and they go ahead to tell you, follow facility protocol. You must always follow facility protocol. So you are preparing to go and pass an NG tube to a patient, you will be able to have to explain the procedure and you position the patient comfortably. Now, there is a difference. When you want to insert an NG tube, the patient has to be in high Fowler's position. It is different from when you want to administer feeding. Look at this picture. The patient is in high Fowler's position with the neck and head supported. Okay, it has to be. High Fowler's means from 60 to 90 degrees. Semi-Fowler's is 30 to 45 degrees. Semi-Fowler's means 30 to 45 degrees. High Fowler's means 60 to 90 degrees. So the patient is like sitting. High Fowler's also means sitting position. Then you have to determine which of the nostril is patent, okay? Which of the nostril is patent, and then you measure the length of the NG tube. How do we measure? These are very important areas that come in examination. In the exam, these are areas of questions, where questions come from. Now, you have to measure from the bridge of the nose to the earlobe and to the xiphoid process. There is an acronym that we use, NEX, N-E-X. NEX means from the bridge of the nose to the earlobe and to the xiphoid. This, you see a small picture here, nose and earlobe to the xiphoid process here. The xiphoid process is below where the sternum ends and below, just here. That is where the xiphoid process is, and that is how you measure the NG tube. So for conscious clients, you have them swallow or drink some water, then you lubricate the tip of the tube and you gently insert when you have identified the nostrils that is patent. You gently insert into the nasopharynx, okay? Now, when the tube is about nearing the back of the throat, you instruct the clients to swallow or take sips of water. But if you face some resistance, you can slowly rotate and you aim it downward, continue to insert, okay? Now, in semi-conscious client, you will have to flex the head towards the chest, bringing the head ahead, a little bit ahead while passing the tube. So now, if the client starts coughing, maybe have some respiratory issues, you just have to withhold a bit or withdraw it a little bit and let the respiratory stress subside, and then you continue. Please don't remove it. It says withhold it a bit, just hold it, let the patient relax, and then you continue. This is an important area. You're going to see a question that will ask you a question in this area. So I say you just have to withhold it a bit, you just withdraw it a bit, let the respiratory stress subside, and then you continue to insert the tube. Now, how do we check for the patency to say the NG tube is in the stomach? We know in nursing school, we're told you need to use a stethoscope to listen to the sound, or maybe you need to use a litmus paper. Can you remember that? They told us in school, right? You need to aspirate the stomach contents and check for acidity, But the best possible way is chest abdominal X-ray. That is the best way to check and be sure that the NG tube is in the stomach. You can see the X-ray here. You can see something yellowish here. This is the tube. The stomach is tilted to the left side, right? To the left side. This is why the tube comes here like this, you see. So checking to be sure that the tube is inside, you use abdominal X-ray. Okay. Now, what do? Connect the tube as prescribed, secure to the nose. This one is okay. Observe for nausea, vomiting, abdominal distension. Now, next is you have to check for residual volume. Every 4 hours, the tube is already in place, and maybe you want to administer food or medication, Checking the residual every 4 hours is also to make sure that the NG tube is patent, is in place, and every time that you want to feed the patient, okay, you have to check. Now, if you aspirate and the stomach content, what is called the residual volume, is more than 100. Listen, it's more than 100 mils. Reinstill it and withhold the feeding. Okay? Put it back into the stomach. Don't discard it. That is the patient feeding. Reinstill it back and withhold. That means keep feeding at a particular time that you want to feed the patient. But if the residual volume, stomach content, is less than 100, reinstill it and continue feeding. Feed the patient, okay? So you have to flush before and after. You have to flush before and after. Now, also, you have to check anytime you want to feed. Remember, when we say abdominal X-ray, is to check that the NG tube is in place at the time of insertion, when you initially insert it. Now, but subsequently, when you want to feed the patient, you want to know if it is inside, the pH is enough for you to check, okay? You can aspirate the stomach content and you check the pH. Remember, the stomach content is acidic. So it should be 3.5 or below, confirming that it is in the stomach, meaning the NG tube is in the stomach. If it is above this, it is not in the stomach. You have to inform the healthcare professional, okay, to maybe order for the reinsertion. They will have to remove and reinsert. You have to check the pH. So make sure that you also observe for fluid and electrolyte imbalance. Check the skin, change the side of the tube, tape it from different side of the nostrils to avoid excoriation, and also skin dryness. Apply some lotion. Now, how do we remove the tube? Oh, okay. Nurse Franklin, please. The doctor has ordered for the removal of NG tube of patient in room 5. We have to remove the NG tube. You just remove. It is not done like that, you know. So how, you know, we have removed NG tube, right? We remove NG tube, but there are little things that we learn in school and we don't practice it and we neglect it, you know. It's very, very important. So there's what we call Valsalva maneuver. You have to ask the patient to take a deep breath and hold while you remove the tube. This is very, very important. These are things that when you practice them, you know, you find it easy and lively. You enjoy nursing. You enjoy doing it, you know. What's this for? Please, I have to remove your energy tube, and then you pull out. No, these are very important steps to practice. So you ask the patient to do what? Deep breathe and hold at the time of removal. At the time of removal, and that is how we remove the NG tube. We are done with NG tube, and the next one is Pecutianus endoscopic gastrostomy. That's what we call PEC tube. Yes, for those who are in the UAE, most of you have practiced with PEC tube. I don't know in other countries how it is. I've never seen a PEC tube when I was in Cameroon. I've never practiced the PEC tube. We only see NG tube. So the PEC tube is inserted from the abdomen into the stomach, okay, or into the small intestine. But the NG tube is from the nostrils. These are two different tubes, okay? So yeah, that's just the reality. That's the truth. No, I've never practiced in Camo. I've never seen a PEC tube. I came and I saw the PEC tube, but here, so that's it. So this is how they look like. They have a balloon here, they have a disc here, and we're going to see. So what are they used for? What are they used for? Indication. What are they used for? Used to provide nutrition, okay? Maybe when the oral intake is not enough, and maybe like in case of dysphagia, and maybe sedation, maybe after some abdominal surgery procedures, you know, so they need to put in place NG tube, and also to decompress the stomach, and also used as a long-term care patient. Yes, most of the patients who are in long-term care, they use PEC tube, you know, patients who have swallowing issues, and they cannot just go by oral intake, and they are maybe in bed, they're bedridden, you know, there's nothing they go, they are feeding through a PEC tube. Maybe when they feed, they get aspirated, you know, all the time. They don't waste time here. They don't waste time here. They put the PEC tube, and the patient feeds through that, you know. The PEC tube, the feeding pump, they can also, you know, connect the feeding from the feeding pump to the PEC tube. You can also administer feeding manually using feeding syringe. Okay, how to administer medication? If you had the GI tube, like the PEC tube that we're saying, medication and feeding, all the like, we can administer through the PEC tube. Like I said, it is inserted from the abdomen into the stomach, or most often is into the small intestine or into the jejunum. Okay, this is inserted into this patient. And there's always a stoma that is the part of the skin. It's out. This one is when it is inserted, there's a balloon inside, like I showed, there's a balloon here. This balloon is inflated, you know, it seems to protect it. And all of this area, let me see. Okay. From here to downward is in the small intestine. From here is this the part that goes inside, as you can see here. Then this protection here. So you have the tube, this area, they have some caps here. Some caps here, you after feeding, you can cap it back, you can cover it, and to avoid maybe dirt going in, some bacteria going in, you know. And whenever you want to feed, you use a new feeding syringe, and you just connect it to the tip here, and you can pass the feeding here. So we say you have to always check the healthcare professional prescription, prepare your medication, ensure that the prescribed medication can be crushed. You know, we have medication that you are not allowed to crush, and we have medication that you can crush. Be sure that this medication can dissolve, because we have medication that comes in granules and cannot dissolve. It's difficult to administer through peg tube, but if you have practiced over and over, there's a technique that we always apply to administer this medication that comes in granules, you know. Now you dissolve this medication in 15 to 30 mils and verify the client and explain the procedure. We have.
Anybody who can go under which day under.
Can you mute your volume? You can have your discussion in the house, but if your volume is muted, we will not hear you. Okay, thank you so much. Now, there's what we call two identifiers, two patient identifiers. We always say that that is the name and the date of birth of the patient. You can use other parameters to identify the patient. Be sure that you are feeding the right, like in the hospital setting. But if you're working on one-on-one setting, you know that it's the right patient, but always try to check and explain your procedure. Make sure that the tube is in the right place. You have to check bowel sound. If the bowel sound are absent, please don't administer the medication. Notify the healthcare professional. If there is no bowel sound, use the stethoscope to check the bowel sound. Then when the bowel sounds are present, you can pour the medication at the tip of into the catheter tip syringe is here, like I explained before. There is a clamp. You have to clamp. You pour it, then you unclamp and allow it to go by gravity. Please don't use the plunger of the syringe to, let me say, infuse the medication and the feeding. When you pour, allow it to go by gravity. It open the clamp. This is a clamp here. It's a clamp here. So you open the clamp and it will go by gravity. Don't use the plunger of the syringe to infuse or to push the medication to go by force. No, that's not allowed. Now, you have to flush 30 to 50 ml of water as ordered. Then you clamp the tube for 30 to 60 minutes, depending on facility policy. Document your procedure. Always make sure you place your patient in comfortable position after every procedure. Don't just finish your procedure and then you leave. It's fine for you to go. No, always make sure that you're okay. You ask, want me to do, have something you want me to do for you, you know. Put what the patient need to take to the reach of the patient, no? Beside the patient bed, you know, the patient should be comfortable before you leave. Now, in this tube feeding, we have some terminologies, you know, these are just medical terminologies that we use. Maybe you've seen them in some questions. What do you mean by a bolus, continuous feeding, and cyclical, you know? Bolus means you're giving it just like start medication. You know, you're giving it at once, immediately, like you just give start without arrow, STAT, start medication, just at once. Then continuous, the patient is on 24 hours, and intermittent you give, and then you stop, and then you give. Now, what are some of the precautions that you have to take if a patient is on PEG tube feeding? This is the PEG tube here. It's inserted. You can see here. This is how it looks like. It's on your abdomen, and the feeding goes inside. You have to take care of the stomach side, clean it with normal saline. Depending on your facility, if you are cleaning it twice a day, and you check for the coloration and the side, the stomach side, check to know, is it pink? There's some discharges coming from there. What's the color of the discharge? Because you have to report that. So you always assess the placement of the tube before instilling feeding. These are some of the precautions you always have to take, because this can risk aspiration if the tube is wrongly placed, right? Now, change feeding container tubing every 24 hours. Maybe you have a question and they ask you, you get into the patient's room and you find a feeding tube hanging there, and the time label there was yesterday, let me say today is 16, and it was yesterday 4 p.m. And now you're getting in is about 6 p.m. That is more than 24 hours. What will you do? You just have to discard it, right? It shouldn't be hanging there for more than 24 hours. Even if there's feeding inside, no, you have to discard it and change, get a new feeding bag and hang it there. Don't keep it there. It's room for bacteria growth, you know, so room for bacterial growth. So you check the expiration date of the feeding tube before hanging, you know. Do not hang more than required. For example, the patient is ordered to take 2 feeding bags, maybe every 4 hours, and you are on duty alone. You just feel that I need to just hang 2 bags there. When the first one is done, I just change it to the next one. No, it's not done like that. When the feeding is over, and then you can hang the other one, and just hang 2 feeding bags there if they are not used at the same time. Okay, if they are not used at the same time. So like I said, you can use infusion pump, and if the client vomits, please stop the feeding and place the client in sideline position. Sideline position. If the client vomits, maybe in the due course of administering feeding, stop, place in sideline position. Now, to prevent clot, sometimes, like I said, there are some medications that come in granules, and maybe the tube gets clot, or maybe you did not flush. Like sometimes there is flushing that you have to flush maybe 150 mils or 100 mils every 4 hours, and you did not flush, the tube will get clogged, right? So you have to prevent clogging of the tube by always flushing as prescribed. You have to flush before and after administering medication, and every 4 hours, or as prescribed by a physician. And that's that. There are some complications when some patients are placed on tube feeding. These patients are on tube feeding. They are not eating their food, they're not passing through the stomach into them, just going directly into the lower GIT. And some complications are bound to occur, or maybe even if those that are on NG tube, you know, there are some complications that are bound to occur. Most of them, sometimes they have diarrhea, they can have aspiration. We've mentioned that. Closed tube, vomiting, we've mentioned that. So these are some of the complications that patients who are on NG tube and PEG tube can encounter. And you, if you've worked with patients on this, you might have come across some of these complications. And how do you manage them? We just explained in this brief explanation. Before we go to questions, I will want you to unmute yourself and ask your questions. If you have a question, just indicate, unmute yourself, ask a question. After that, we'll do some practice questions. I got some questions here for you guys. I got some questions here for you guys. Any question? Have no voice.
Yes, sir.
Yes.
In a situation where the tube is dislodged, let me say I'm on duty, and then the PEC tube is dislodged.
Yeah.
In that situation, am I supposed to first of all cover the PEC tube maybe with a sterile gauze or with a catheter, or I should first of all call the ambulance? Or maybe inform the medical doctor. So which are we supposed to do first?
Okay, your question, I hope all of us are getting the question and we will learn. Maybe you have the same question. If somebody asks your question, just listen, get the answer so that you don't ask the same question again. Okay, you have asked your question and you have given two options and which one should we do? So you already know what you have to do, but you don't know which to do first, right? That is what I can say. Okay. Now, patient safety first. In everything you do, patient safety first. So you have to, this is not something that will take you much time. You have to cover the stoma with soaked gauze in normal saline, okay? Soak gauze in normal saline and cover the stoma side. Why? You want to prevent infections from going in. And then you can call your ambulance. This is the first thing you have to do. Yep.
Okay, sir, because I have a lot of controversy concerning that one.
Okay.
Like in my facility, they will say you can put first a Foley catheter into the stomach so that the stomach does not closes. Because for me, I said, okay, first of all, let's cover it with the sterile gauze. And they said, no, this is what you have to do. So per facilities, let me say in the case of PEC tube, does it have, each facility, do they have their own way of doing it, or is just general?
Okay. In the course of my explanation, I said there are some nursing procedures that we carry that we learn in nursing school and we continue to learn. And when they give steps of this procedure, at one point they will always tell you, please follow the facility protocol, okay? Now, in the case of putting a Foley catheter to prevent the stomach from blocking is correct. Very, very correct. It's fine. It depends on the nurse taking care of this patient if you know how to insert this Foley catheter. If you don't know, then cover it with the gauze and call the ambulance as quick as you can. But if you know how to put the Foley catheter there in order to prevent the stomach from blocking, then you can close it around with still the gauze, the same gauze, then it's fine. Then it's fine. Just follow what your facility tells you to do.
Okay, good.
Okay, I know we read, like I said, this section is more of question and answer, but I want us to have an idea of what we are going to see. When we answer 5 questions from this topic, from the explanation, you'll be able to answer more questions when you meet them in the future. Not only going into the question and answer, will not understand what it's all about. That's why I've decided to make the note this way. Okay, let's get into the questions. Question number 1. This is our question number 1. the nurse, I hope we all seeing my screen, right?
I'm not seeing it.
Look at it again. Let me know. I've shared my screen. I've shared my screen.
No, I'm just saying switch to screen share.
Then you should.
Okay, wait, switch to screen share.
Hello guys,
okay.
Are we together?
Yeah. Yeah, sure, Ada.
You can.
Yes.
You can, yeah. Okay. The nurse is preparing to administer medication through a nasogastric tube that is connected to suction. To administer the medication, the nurse should take which action? You are about to administer medication. What action should you take first? Okay, that's what this question is talking. You're about to administer medication. The nurse should take which action? Okay. Now, A says, position the client supine to assist in medication absorption. Supine. Supine. Aspirate an esogastric tube after medication administration to maintain patency. Aspirate the nasogastric tube after medication. Is it okay? Clamp the nasogastric tube for 30 to 60 minutes following administration of the medication. Change the suction setting to low intermittent suction for 30 minutes after medication administration. Okay, let's go back to the question. You have to understand the question, then you can be able to get the answer. They said the nurse preparing to administer medication through a nasogastric tube that is connected to suction. To administer the medication, the nurse should take which action? Who can try that one? Yeah, in our note, we said when you administer medication, what do? Position the client in semi-Fowler's flush before and after medication. You should clamp the tube for 30 to 60 minutes. So you can answer this question by first of all removing the wrong ones. Position the client.
Clamp the nasogastric tube 30 to 60 minutes.
So position the client supine. No, it cannot be supine, right? There you already removed that. The position itself is not correct. So you have to do the position to place the patient when feeding. Okay. Aspirate the nasogastric tube after medication administration to maintain patency. No, it doesn't. It doesn't. You have to aspirate before. After medication, you are flushing before. So you don't do that. B is kick out. No. No, we don't. Clamp the nasogastric tube 30 to 60 minutes following administration of medication. Okay, let's go change the suction. No, the answer is C.
Clamp the nasogastric tube.
That's the right answer. Question number 2. The nurse is assessing for correct placement of nasogastric tube. The nurse aspirates the stomach contents, checks the gastric pH, and notes a pH of 7.35. Okay. I said it before. Based on this information, which action should the nurse take at this time? pH is 7.35. What is the stomach pH? We say it should be, for us to be sure that the NG tube is in the stomach, it should be 3.5 or below, right? It should be. This one says 7.35. This is higher than this. It's an indication that the NG tube is not in the stomach. They say, based on this information, which action should a nurse take at this time? Retest the pH using another strip. Document that the nasogastric tube is in the correct placement. Really? Is it in the correct placement? No. Check for placement by auscultating for air injected into the tube. Call the healthcare provider to request a prescription for a chest radiography. Yes. The answer is you have to inform the healthcare provider. They have to do a chest. They have to do a chest radiography to see where the NG tube is. Because this is already a sign that it is not in the stomach. The pH is more than 3.5. We said if the pH is 3.5 or below, it shows that it is in the stomach. But this pH is more than this. So there should be a chest radiography to find out where it is. And can you mute, please?
You can mute there now.
Hello. Hello, please mute yourself. Mute yourself, please. Question number 3. The registered nurse is preparing to insert a nasogastric tube in an adult client. To determine the accurate measurement of the length of the tube to be inserted, the nurse should take which action? A, mark. Here we are talking about measurement, okay? The length, we are talking about measurement. And what did I say about measurement? There's an acronym that we use called NEX, N-E-X, nose, earlobe, xiphoid process, right?
Yeah.
Let's go. So let's go. Mark the tube this, mark the tube now. Place the tube at the tip of the nose, measured by extending the tube to the earlobe and down to the xiphoid process. Okay. This is place the tube at the tip of the nose, measure by extending the tube to the earlobe and down to the top of the sternum. Sternum? No. So the answer is C. Be careful. These guys are very trickish. They're almost the same, but they got here and they tell you sternum.
Yeah.
You have to be careful. So this is the wrong, so the right answer is C. C is the right answer, okay? Next is nose, ear, and xiphoid process, right?
Yeah.
We learned something new today. This is the acronym. Please mute yourself. Question number 4. The nurse checks for residual before administering a bolus tube feeding to a client with nasogastric tube and obtains a residual amount of 150. What do we say about this? What is the most appropriate action for the nurse to take? Residual of 150. Good. This is a very good move. Before you administer medication, you have to check the residual volume. That is the stomach content. You have to aspirate to get a volume. And we said before, if the volume is above 100, please withhold the medication. We reinsert it, we hold it. And you can administer it, skip that particular time of administration and do it later. So this is 150, it's above 100. So we say, hold the feeding and reinstill the residual amount. Reinstill the residual amount, reinstill the amount and continue with the administration of the feeding, no. Elevate the client's head at least 45 degrees and administer the medication, no. Discard the residual amount and proceed with the, you don't have to discard, please. That is the patient's food. You don't have to discard. Hold the feeding and reinstill the residual amount, A. Are we together? Yes. Question number 5. The nurse is inserting an esogastric tube in an adult client. During the procedure, the client begins to cough and has difficulty breathing. What is the most appropriate action? When I was explaining, I said something about the respiratory status when you are inserting, and at one point, the patient coughs. What do? You have to pull a little bit back, let the respiratory stress subside, and then you can continue inserting. Let's go. A says insert it too quickly. No, you don't do that. Notify the healthcare provider. Why? Why should you notify the healthcare provider? Not everything that you have to call a doctor. Remove the tube and reinsert it when the respiratory, no, you don't have to remove. Remember, you are already inside, okay? You just need to a little bit stable. You're already inside, you don't need to remove it. This is a procedure that irritates, the respiratory system. You don't have to just pull back on the tube, wait until the respiratory distress subsides. So D is the right answer. We learned something new today? Yes. Let's go. 6. The nurse is preparing to administer medication using client's nasogastric tube. Which actions should the nurse take before administering the medication? Select all that apply. This is an NCLEX question. So for DHA, DOH, MOH, they will tell you select more than one option. Okay, you will not see select all that apply. They will tell you more than one option is correct. It means you can choose more than one option. Get it? Not all questions that you must choose one option. Read the instruction very well. They will tell you more than one option is correct, so you can choose 2 or 3 or more. Some in NCLEX, sometimes all the answers are correct. Let's proceed. The nurse is preparing to administer medication using a client's esogastric tube. Which action should the nurse take before administering the medication? Check the residual volume. Of course, that is correct. Aspirate the stomach content. Yeah, of course. Turn off the suction to the nasogastric tube. Turn off. Why? Let's see. Remove the tube and place it in the other nostril. Why? Why? Turn off the suction to the nasogastric tube. Okay. I did not show you. There are some tubes that come. Let's put C and D. I'll explain later. Test the stomach content for pH. Of course, that is correct. This is fine. C is fine. Let me explain to you guys. Turn off the suction to the nasogastric tube. You are about to administer medication, and some tubes they come, they have some ports, some areas that are connected to it. And by the time you want to administer medication, you need to turn off these areas first. I think there are a lot of ICU nurses here. They can better explain to us. They know what I'm trying to explain here. So you turn off that and then you administer the medication. So A, B, C, and E, D is not. So the question is asking us to choose the options that are correct, okay? These are the actions that you're supposed to do before administering medication or feeding to a client who is on NG tube. You don't need to remove the tube pump now. Anytime you want to feed, you remove one. Don't do that. 7. Your patient has PEG tube. Okay, we are now on PEG tube. And you are about to administer a feeding. While checking residual, you obtain 95 ml of stomach contents. What will be your next nursing intervention? We just answer a similar question of this above, and they just change some figures, try to test our reasoning faculty. Simple, right? This is simple. Wait 30 minutes and reassess residual. Why? Why? No need. Administer the scheduled feeding. Yes, it's okay. We said below 100 ml you should administer. B is correct. Skip this scheduled feeding and administer the next feeding due to 6 hours. No. Hold the feeding and immediately notify. Why? Why? Below 100 ml, reinstall it and then administer the feeding. Is cool to go. Question number 8. The patient has a PEG tube and you are about to administer a tube feeding using the feeding pump. You note that the last feeding tube hanging on the pole is labeled August 16 and today's date is August 18. Which nursing action is correct? Oh my God. Did I know that there was a question like this? I explained something like, right? Notify the healthcare provider for further orders. Why? Change the adapter cap at the end of the tubing. Why? Continue to administer the feeding because the tubing is good for 4 days. Like seriously? Immediately discard the tubing and open a new package of tubing before proceeding. Correct. The feeding bag should not be there for more than 24 hours. Okay? You should, even if feeding is still inside, discard it and get a new bag. 24 hours. It shouldn't be more than 24 hours. It shouldn't be more than 24 hours. Question number 9. Which patient should benefit, would benefit from Nasogastric tube? Okay. This question is talking about the indication for NG tube indication. A patient with congestive heart failure, a stroke victim who failed their swallow evaluation, a patient who had a left leg amputation, a patient with a platelet count of 50. Now, one of the indications of NG tube is when you have difficulty swallowing, right? I make mention of that. So here, B is the right option. You have to check the swallowing ability of the client, and the patient failed, you know, maybe you give sips of water and the patient aspirate while taking sips of water, then you know that this patient cannot take food orally and we have to insert an NG tube. That is one of the indications for NG tube. Question number 10 and the last one for D. You just inserted an Esogastic tube. Which of the following is not correct way to check correct placement of the tube? Please, can you mute yourself? Somebody is talking behind the scene. Okay, I'll leave this question for you guys to answer when you see this on YouTube. Get an answer for yourself. We're moving to the next. And what's that? Can we go? Are you tired? Should we end? Let me know. Unmute yourself. Are you tired?
Continue. Let's continue, please.
We are already one. Sorry?
Please, how can we get those questions? You just passed the one we are supposed to answer.
He passed the number 10 question, sir. They do
You will get all of this from the YouTube.
I just got here. What are you supposed to say? Go where?
I'm asking if you're ready for us to go to the next topic or you're tired.
How many questions did we answer so far, please?
We've answered 9 questions on one topic.
So why did you don't the same question? Can you leave it alone?
No, it's for you guys to do it. You
So
do it
how are we
later.
going,
Leave it on the screen.
how are we going to answer it?
Leave it on the screen for us to do. Please.
Okay. Okay. 2 minutes to answer question number 10. One question is 1 minute 30 seconds. I give you 2 minutes to answer question number 10. I'll be back.
I can't see, man.
2 minutes to answer question number 10. I'll be back. In your exam, one question is 1 minute 30 seconds.
Yeah, because she fell in the hand of this guy, they will be from one to another. If this one no work, they will take her to another one. The whole thing will give you a cleaning job.
So she's still doing cleaning jobs.
Put your answer in the comment section. Do you know where to put
Yeah,
the comment? There's an area.
No, the answer is
put there, I will see.
The comment section.
Text your answer, I will see. Just check on the Zoom.
The answer is A.
Yes, to me, the right answer is A.
Text your answer, text your answer, text your answer in the comment section.
I don't even know where to text.
I can't see the comment section.
Same here.
Check where you will see the comment section. Text your answer there, I will see.
The frustration will start. You start looking for another place again.
This way I see no failure.
Where is this?
I did DM you. I did mute this thing. See?
I'm saying your answers. I'm saying answer. Deka, I've seen your answer. Judith, I've seen your answer. V2022. Queen, I've seen your answer. You can take there's an option for you to text to everyone and for you to text to the host. I will suggest you text to everyone. Let everyone see the answer. We all come to a conclusion, right? We are all learning. We're all learning. Adela Hyde, I've seen your answer. Priscilla, I've seen your answer. Mr. John, I've seen your answer. Okay, put the answer there. Let's see. Let's go. Let's go.
Stated in Nasogastric troop, which of the following is not a correct way to check correct?
I need to see the thing again.
2 minutes over. Let's get the right answer. Let's get bell rolling. 2 minutes over. Okay, the question says, you just inserted a nasogastric tube. Which of the following is not a correct way to check correct of the tube? Question interpretation first. Okay, question interpretation. So, this question is telling us that you should select the negative answer. Okay? You should select the negative answer, meaning the other options are the right way to check the placement of the tube. Which one? The one that is not the right way is the answer, is what we want to sort out. Question interpretation is very, very important. A says, administering a 100 cc water flush and assessing for patient pulse. Is that the right way to check placement? Is that the right way? Okay, question mark. Let's go ahead. Obtaining a sample of GI contents through the tube by aspirating. We saw that, right? Please, when I'm talking, can you please mute yourself? Just mute yourself or you don't talk. You're in the house with so many people in. It's advisable you mute yourself because people will be talking at the background. Okay, let's write on. So B, yes, right. We said you have to aspirate. If it is more than 100, we hold a feeding. If it's less than 100, reinstate and administer the feeding. So B is correct. Following the healthcare provider order of an X-ray to confirm placement. Right, that is the right way. One of the right ways, but that is the most important, the first way to do what to do, X-ray. Okay, next. Checking pH of GI content to be 1 to 3.5. Yes, when you aspirate, you check the pH. If it is 1 to 3.5, it means it is in the stomach because we say the pH of the stomach is very, very, very acidic. So A is not a way to check the placement. So A is the answer. So this is the odd option, which has turned out to be what we are looking. So that is the answer, right? So those who said A are right. Those who said B, I think you can now understand why it is A. Maybe you had issue interpreting the question. The question says we should choose for the wrong option. 3 of the answers are correct. Bam. You guys are tired, you know. I can talk for 5 hours.
How long? Okay, this class started at 7.
We will not be able to go to the next topic because you guys are tired.
You are not tired.
You're not tired. Oh my God. So, the next topic we were supposed to do endotrachea and tracheostomy. Oh, this is a good section, huh? It's a good section.
That person resemble
So, guys, if you want to talk, unmute yourself and let us know how the class was.
More go break, go chop.
I'll come back when.
Yeah, we're ending at 8:30. We are ending. We are not going to the next topic. Let me hear, how was the experience? How was this? Tell me, let me hear from you guys. Did you learn anything new?
Yeah, that's so good and nice. At least I learned something like the next NEX.
Yeah. Okay. Well, I hide, your hand is up. Let me hear from you.
You're recording this
Yes.
this thing.
Yes.
Can we get the record? I did not start from the beginning.
I set it already. You will get it.
Thank you. I'm at work, so I just use this 30 minutes for food time to come and be here.
Okay.
All right. Bye. It was very interesting and explicit, and we learned some new stuff. Thank you very much.
You're welcome.
Also, I learned something of question interpretation.
Okay, that's good.
Yeah. The last question was so tricky.
Okay. Okay.
Yeah.
Good to learn
As for
something.
me, I've learned a lot also because I never experienced something like peg tube. So this is my first time of
Okay. You did not only get questions on peg tube, you had the opportunity to get some explanations on how peg tube functions, right?
Pardon? Non, mon ventre ne dérange pas. C'est parce que je n'ai jamais mangé.
Can you mute yourself if you guys? Oh my God. Okay, without much to say, I would say thank you guys so much for spending your time and being here, because I wouldn't be here talking if you are not there, right? So thanks for honoring the invitation.
Thank you, sir, for
I hope you learn
and
something.
thank you for sparing us your time and educating
Are we
us
done so soon?
well.
Sorry?
It's so short.
My
So
dear, some people want Mr. John decided to run away, taking another topic.
I'm not running away. You guys are tired.
I just came in a few minutes ago. I thought it would be like 2 hours.
Okay.
No wonder.
We will try to make sure that we have it within an hour. We started about 20 minutes past 7. It's 1 hour, 1 hour, few minutes. We'll try to make sure that it is 1 hour, because if it is too long, the brain might not be able to absorb.
Oh, okay. Thank you.
We'll try to make it short. Yeah. Okay, guys.
Thank you.
Have a nice day and bye-bye. I'm signing off.
Thank you, sir. Bye.
Bye.
Bye.